going back in history, was a harness racing track.
During World War I, the Army put a hospital there.
Grasslands was a rundown facility. It was thought of as being a hospital that was available for underprivileged.
Sunshine Cottage with the different paintings of rabbits and little fairy tale animals on it. That was a children's polio hospital.
Grasslands was viewed as sort of like a dumping ground for county facilities that were controversial.
Oh, it used to be a hospital for like almost the insane asylum, we called it.
Grasslands was just kind of a place of last resort. It just had that reputation.
Just before I had come, Ed McCallion, who was the county executive, kind of evolved a vision of what the medical center would be, that it would be a tertiary care hospital.
In order to raise the quality of the hospital, he had to make it a teaching hospital. They were running a hospital in New York City that was then known as Flower Fifth Avenue Hospital.
I put together with McCallion an affiliation agreement in '71. We did it in 2 hours.
And that really began to build not only a relationship, but also change the whole demeanor of the hospital and its image and its services. It helped recruit top-flight faculties.
The main tower was built in the 1970s.
It was a brand new facility. We had electric beds, we didn't have crank beds, and this was 77, 78, We were moving into the future.
Al Del Bello then carried that through in every possible respect.
He built it. He made sure it went.
The condition in which it was turned over to him, it was either do or die.
We were under a threat of closure from the Board of Legislators, which I understood.
But Al was a very dynamic person. He was a visionary, and he saw this as a facility that would become a world-class hospital.
They doubted it. How could this be done? It was never done before.
It was such a difficult quest, and he achieved it.
It's no longer Grasslands. It's Westchester County Medical Center.
In the 80s and 90s, the medical center was really a pioneer.
The medical center in 1981 had about 60 or 70 patients, but there really wasn't much surgery being performed.
When I came, we had started cardiothoracic surgery. The burn unit had recently opened. The trauma service was just getting going, and we were building an oasis in Westchester, and it was great. All of neonatology, and we had the only behavioral health center.
In about 1994 or so, Mr. O'Rourke, then the county executive, put in the budget a $10,000 item to study the feasibility for a children's hospital.
So it was all an opportunity to build and grow, and it was enormously rewarding.
All we knew was every year whatever the shortfall was, we covered it. And all we knew was every year that shortfall was getting bigger.
It required a different outside-the-box thinking.
When I came back as commissioner in 1994,
he says, you have to privatize the medical center. I said, I'm not going to tell O'Rourke that. You go tell Andy O'Rourke. He said he won't talk to me. So I went and tell Andy O'Rourke. He says, we're not doing that. What do you mean we're going to privatize the medical center? It's been around since 1917. A guy named Stephen Galiff came to see him. Stephen was chairman of the board of the medical center.
He actually spent so much time on it.
And I was so much of the belief that if we didn't get the Westchester Healthcare Corporation in place, we would not survive 5 years.
The idea was right, but the execution wasn't always the way it probably should have been.
To see your child sick, to see other people with children very ill, it was certainly a life-changing experience.
Her care was phenomenal, absolutely phenomenal. I think the doctors were brilliant. It diagnosed her immediately. There wasn't a chair to sit on or anything. You could just stand by the bedside.
We thought there could be a better way to treat children and their families.
The Ferrari story was such a moving story that it was very hard for anybody that they sat with to say no.
Over 25,000 people that were involved in it, and they made it happen.
The Children's Hospital is one of these superb institutions that came from a tragedy.
John and Brenda Ferrari are true heroes.
It wasn't until the early 2000s, around the time that I became chair, that we started to see a squeeze along the lines of the economics.
And all of a sudden, at the end of '02, we were advised we're in serious trouble.
The problem was that we were in much more trouble than we actually even knew.
It was an infrastructure, economic issue, as well as a healthcare issue.
Everybody was trying to figure out whose fault it was.
When I determined that we had less than 60 days of cash, under the New York state law, we couldn't continue. And I knew you had to go to the brink. So I had our council prepare a closure plan.
We had no choice.
It probably was one of the largest problems to ever confront Westchester County government up until that point.
And there, for the grace of God, I think it was from the sheer dedication and will of the doctors and nurses there that place was able to function.
I don't think it ever crossed my mind that the place would close.
In their own way, I think they really saved the hospital. I don't think without them we would have survived.
The compliment is that as we went through these tough times, the patients never felt the difference.
But we survived through because people were committed to staying there. We had been there already. That was already our homes.
I think it made people band together more closely.
I think the place has always benefited from people who saw something bigger than themselves in the greater picture.
We went to Albany 15, 20 times, and we created the argument for the first time about the economics of healthcare.
We issued a report, got a lot of publicity. You know, the one thing that I knew was the importance of the medical center to the community.
We had money left with the tobacco barns, which, by the way, I could have used to lower taxes.
Everybody worked together on the state level, on the county level, Democrat, Republican. There was no partisanship.
I never thought that the state of New York could allow this facility to go out of existence. The governor was totally committed.
What was important was that the vision that was first put into place in the 70s and reestablished when we redid the hospital governance, that never changed.
It takes creativity, it takes genius, it takes hard work, it takes a love affair.
David Pitts called me. He said, look, I have the management contract on Westchester. Would you consider going up there as the CEO? And I immediately said, David, I thought you liked me. Well, my first day walking around the hospital, being introduced, I remember a couple people coming up to me and asking me if they were going to get paid. Over the previous 4 years, the place had lost about $250 million.
$60 million that we saw in just contractual and reimbursement deals. And we pretty much identified that in a matter of hours, weeks.
What I was most amazed of, how smart the staff was here. This was a Yugo assembly line that turned out Mercedes. So one of the first things we did was we worked through arrangements with companies to get that technology in.
All the money and profitability that was achieved was all reinvested back into the medical center.
We had to change our mindset. Yes, this campus's mission can remain exactly what it was. However, we are going to have to develop a network so that we can compete in the new world.
To now having 10 hospitals dispersed on either side of the Hudson with a primary care initiative that includes well over 200 primary care provider partners.
It is amazing, the network.
It's remarkable.
It's been an amazing transformation.
We're in a really good place right now.
It's come a long way from just being a tuberculosis hospital and a hospital for poor people. It's an incredibly important medical institution.
Westchester Medical Center is probably the greatest success story in the modern era of Westchester County.
And that's something that makes me smile when I'm going down to spray.
You're going to the A+ team at the medical center. You're going to the best of the best.
This is a great organization, and I think all of us feel very blessed to be here.
Hopefully it'll be there for another 100 years and more.